A new survey suggests some Americans could do more to cut the cost of prescription drugs. The University of Michigan poll shows 27% of people call the cost of their medications a burden. Only 51% said they brought it up with their doctor. But for those who did discuss the issue with their doctor, about 2/3 say their physician recommended a drug that cost less. Our Dr. David Agus is in Los Angeles. Doctor, so it is a big question here. If somebody can get a drug for $25 a month that they're paying $100 a month for now, why wouldn't the doctor bring that up to begin with them?
Jeff, it's a key question. I mean, the University of Michigan poll actually surprised me. Is when I prescribe a drug to a patient, I look at what the condition is and what drug will work. I don't know their insurance plan. I don't know how much they're reimbursed for that drug. And in many cases, I don't even know the cost of the drug. And so it's difficult as a physician to be able to do that. If a patient says to me, I have trouble paying for my drugs, I'm going to go and find the lowest cost generic drug that can achieve what I want it to achieve and actually get value. But we don't know most of the time the costs.
But there is a significant difference in cost between the generic and the brand name. But sometimes there isn't a generic drug, right?
No question about it. There are cases where you're going to have to use a brand drug. But there are a lot of ways to get from point A to point B. So even if there's only a brand drug to do one thing, there may be a generic drug that will do a similar thing by a different means. And so it's very important to do that. You know, there are hundreds of drugs that you can get at a Walmart, for example, for $10 for a 90-day supply without health insurance. So there are a lot of drugs that are cheap, and most conditions are covered by those drugs.
So how do doctors decide if they're going to prescribe the generic or the brand name? Why don't they just always prescribe the generic if you can get it?
Well, most of the time you just write a drug, and
yeah.
you know, I don't know if they're all generic. You know, the FDA commissioner Scott Gottlieb last week held up a 10-page list of drugs that are generic, but there's only one generic, so the price hasn't come down yet. So it's not only generic, you have to look for generics where there's competition to lower the price. It's a complex world in terms of pricing of drugs.
And you say we should always buy the prescription at the same place. Why?
Well, I think you should get all your prescriptions at one pharmacy, because the pharmacist is going to be able to look at all the drugs you're on and look for interactions. When you buy something at one pharmacy and another pharmacy, they don't know everything you're on. And that pharmacist is key in taking care of the patients.
What other steps can you take to discount your medications?
Well, in many cases, you have to use a brand drug. And so in that case, if cost is really an issue and there's economic toxicity, Google the name of the pharmaceutical company and patient's assistance. And what you'll find is programs that most of the pharmaceutical companies have that, based on your income, can actually discount the drug, or there can be coupons or other ways to lower the cost of the drug.
And then it's worth re-asking every once in a while if something can be shifted from brand name to generic, right?
No question. Is ask your doctor all the time. I mean, especially if cost is an issue, and say, you know, cost is an issue for drugs for me. Is there another way to achieve what you're doing without a higher cost? And most of the time, the doctors will find a way. But I also want you every year to look at the list of prescriptions you're on and review them. Many times you're on a drug and it's a legacy drug. People forgot you're on it and you stay on it. So review that list every year.
That's really important
That's really
advice.
good advice.
Always good to see you, Dr. David Agus. Thank you so much.
Great to see you guys. Thank you.